Yeah, well, welcome back to the Foot and Ankle Orthopedic Surgeon. We've got a bit of new branding today, but we're going to go through our Sports Corner analysis today. This time, fortunately, looking at cricket, Big Bash League in Australia. Cricket's a real favourite sport of mine. And look, I do see plenty of foot and ankle injuries, mostly fast bowlers, but we start to see some people crashing the fences, tripping over ropes, that sort of thing. So today we're going to look at the Big Bash League, the Hobart Hurricanes versus the Melbourne Stars, just at the start of the new year this year. The injury happened to Nic Maddinson, so former New South Wales player playing for the Melbourne Stars, is a gun batsman, and unfortunately he tripped over a rope and needed to be subbed out and suffered what's called a low ankle sprain, which is that common ankle sprain that we talked about with Kurt Mann middle of last year. So Nic Maddinson, low ankle sprain. By low ankle sprain, I mean it's not what's called a syndesmotic injury. So it's the most common type of ankle sprain. It occurs to those green ligaments down the bottom. So going through the anatomy of the ankle, this is looking at the ankle from the front. The big bone there that we're about to draw is the shin bone, known as the tibia. The little bone next to it that takes about an eighth of your weight is the fibula, and we're just going to point that out there. So it sits on the little toe side of your ankle. And then the circle bone there is the heel, and the little square that's on top of it is called the talus. Now the talus and the tibia, so your shin bone, make up your ankle. And we're talking about these green ligaments, the one down the bottom here that you commonly injure when you sprain your ankle and roll it in. And their names are the ATFL and the CFL. Now the red ligaments above it are the syndesmotic injuries that you hear about in the NRL, and we'll talk about that in another video. But this is what happened to Nic Maddinson. So his foot rolled in, right? And all those ligaments on the outer side there in green would have really been put on stretched, and he really struggled to walk after having that injury. So just to go through that again, this is the position that your foot gets in. Your little toe gets tilted down, your big toe gets tilted up, and that's known as an inversion injury. And I'm just putting an arrow here just to show where all the tension is, and that's where those ligaments are that we put up in the model. Now, this is a play-by-play of what happened to Nic Maddinson. So initially his foot was square down, then it started to roll in, and then it started to roll in an awful lot. And so we're just going to show that on the anatomical model here, that when his foot was roughly straight down, those ligaments are where they should be in the green there. Then as his foot starts to roll in, his heel and the talus start to roll in, and those ligaments get to be put on a bit more stretch. And then as it really rolls in there, it's likely those ligaments got really stretched out or possibly torn. And we're going to see that in the green there, see how the ends aren't meeting anymore and that talus and the heel are really tilted in. The good news though is it's very unlikely he's going to need surgery. In terms of where he was likely to be tender, where that little green spot here is the most likely spot, that's where those ligaments are. Unfortunately, he's probably also going to be tender over the syndesmosis, which are those ligaments further up, which is the red ones, and that's what makes it hard to diagnose a syndesmotic injury because they're often tender even in this type of sprain. And he might be a bit sore over the other side of his ankle too because there's another ligament there called the deltoid, which often cops it a bit in this type of sprain. Now, physiotherapists, surgeons, radiologists, we all like to grade injuries. It often is supposed to help in terms of treatment. It doesn't help much. Unfortunately, with the common low ankle sprain, because a grade 1, anyone could have come up with this. It's minus tenderness, minor swelling, not much change in your function. Grade 3, really sore, really swollen, difficult to weight bear, and the grade 2 is somewhere in between those. But it actually doesn't change much how we treat the patient. They're largely treated the same, and very rarely do they need surgery. So no matter what your grade is, it doesn't make a difference whether you need surgery. Things might look really bad, but it's very unlikely you're going to need an operation for these type of injuries. What Nic Maddinson probably really did have is police therapy. Now, police therapy is just a whole lot of initial what we call conservative treatment. So what that means is often you need to protect the ankle, whether that's with a brace or with a boot, to prevent the ankle from rolling in again and putting more tension on those injured ligaments. The next one is known as optimal loading. So depending on how sore Nic was, would depend on how much weight he's allowed to put on it, or he might be assisted with the use of a boot as he's walking on it. But they may say wanted to keep him off it for a couple of days because he's quite swollen and quite sore, and he might have had one of those grade 3 injuries. Now, ice is really important for any injury, but its main use is to reduce swelling and to reduce inflammation. So no doubt he would have got that on straight away. And then the next one is compression. So putting a compression bandage to help reduce that swelling around the ankle. And then the last one is elevation. So if you put your foot up above your heart, up on 2 pillows for most of the day, that will really assist in reducing the swelling, and that's particularly important in those first 2 weeks, but particularly important in those first couple of days. And then no doubt he'd be already undergoing some aggressive physiotherapy, and the aim of that is to increase or maintain your range of motion, because you won't want to move it. In the body, if you don't use something, you tend to lose it, so it's important to get into physio straight away. Strengthening, that's in terms of strengthening the tendons and the muscles on the outer aspect of the ankle to reduce the chance of you spraining your ankle again, but realistically you probably won't do a heap of strength work until his pain subsides. And then the last one is proprioception. So proprioception is knowing where your leg is in space even though you can't see it. So for instance, if I put my hand behind my back, I know where it is, but I can't see it. And there are exercises your physiotherapist can do that to reduce your chance of having a similar injury in the future. Now, therapies that have been shown to have no effect, unfortunately, in the medical literature are things like low intensity ultrasound, laser therapy, and the other one is electrotherapy. Now, not that they're really harmful, but they just haven't been shown to have a great therapeutic benefit in the literature, and hence I think it'd probably be unlikely that he would be undergoing these type of treatments. What he probably is having is lots of physiotherapy. Now, in terms of return to play, I think we went through this with Kurtman earlier in the year, but it's generally about 7 to 18 days from studies that have been done, particularly in professional soccer players. But most professional athletes will get back within about 4 weeks or so, and that's because they're getting round-the-clock physiotherapy. They're doing their rehab day-to-day. You and me probably not getting that as quickly, and so it might be a bit longer for us. In terms of possible repercussions of this type of injury, well, about 40% of your average people, so the general population, have some residual symptoms in the ankle after this type of injury, and we're actually much more likely to have another ankle sprain, up to 5 times the risk. And that's the main reason for wearing an ankle brace, to reduce the risk of spraining it and also to undertake your physiotherapy. But the brace here, as we see, 70% is very effective. I doubt we'll see Nic Maddinson in a brace because it's hard to play cricket in it, but certainly professional soccer players, league players have been shown to have just as good results with wearing it. Now, why might Nic have some persisting symptoms? That's because he may have had an associated injury with his low ankle sprain. So one of those is an osteochondral defect, as we're pointing out here, and that's where you take off a chip of cartilage off the bone. The other one is something called anterolateral impingement, which means you get some scar tissue or some spurs at the front of the ankle, which cause you ongoing pain, and occasionally you need surgery for that. Certainly a sprain can stir that up. The third one is the position of your feet. So if your heel points in, which is only a small portion of the population, then it will really load up the outer aspect of your ankle, and that can result in more sprains and pain. And the last one is an injury to what we call the peroneal tendons in the yellow and red there, which is on the outer side of your ankle. And they can be torn, and the pain will not go away if that's the case. So if you happen to have one of those injuries, despite good physiotherapy, you'll have ongoing symptoms at sort of the 6 to 8 week mark. Now, I hope you've enjoyed my talk. We have to put a disclaimer in here that you can't treat yourself off these videos. These are just to give you guys an idea and good education on the type of injuries and give you some idea of what the player is going through. I haven't assessed this player, I'm just going off a video. I don't know or have any relationships with the people involved, so there's obviously a chance I can be wrong, but I'm going off what I see from media, and then basing this on my experience. But look, what you really need to take out of this video is to give you an idea of how the injury happens and how it might be treated and how you can sometimes apply this to yourself, but I would advise you to see your doctor if you have an injury like this, as the information in these videos doesn't always apply to you. So visit us at hunterfootandankle.com.au for more information, but thank you for listening to us today. Bye.